So the last presentation is by Areeha. And are you ready to share your slides? Yeah, cool. Very good.
I will get that there. And can you see my slides okay?
Yes, we can. Yeah.
Okay, perfect. So yeah, thanks for coming and viewing my presentation, everyone. So yeah, I'm going to be going over medical issues that are faced by female astronauts and then how AI and technology can be implemented to combat these medical issues. So here's a little outline of what I'll be going over today. So first, I'll be giving a bit of historical context regarding women's health and the relationship women's health has with spaceflight. Specifically, I'll touch on the lack of research regarding women's health and spaceflight and the knowledge gap that has resulted because of this lack of research. So secondly, I'll be going over specific medical issues that are faced by women during spaceflight due to anatomical differences between male astronauts and female astronauts. Some female astronaut body systems are put at increased medical risks. So I'll be giving an overview about what some of these increased medical risks are. Thirdly, I'm going to look at how AI and technology can potentially be applied and implemented to these issues in the future to reduce these risks that are faced by astronauts when completing spaceflight. So first, why worry about women's health in space? So given that I think personally, it's very critical to investigate like how sex impacts human spaceflight in order to ensure the safety of all astronauts. Though spaceflight is important for like research and exploration, I think one of the utmost like primary concerns is the safety of the astronauts that take part in spaceflight. So then given that women account for around 11% of all astronauts, there is a significant data gap that must be addressed when developing space technology for mixed crew space missions in the future. So why worry about women's health in space? Additionally, women are becoming more and more involved in spaceflight, which is really great. So NASA, as well as the Canadian Space Agency and other space organizations have voiced intentions to have both women and men equally represented on future trips to Mars and to the moon, so as well as in commercial spaceflight as well. So therefore, as a result, research into female health in space, as well as the development of risk mitigation strategies and technologies should be addressed and are really essential to ensure the safety of these astronauts. So next, I'll be giving a little bit of historic context around women's involvement in spaceflight. So in 1963, Valentina Tereshkova became the first woman to go to space. So after this, no woman went to space for almost 20 years. So there was a significant gap there. The USSR had sent Svetlana Savitskaya to space in 1982. And then this was followed by the US sending the first American woman to space. And this was Sally Ride in 1983. So as you can see, there weren't a lot of female astronauts going to space within this time, as well as they were spaced apart. So this alone created a major data gap in understanding the effects space has on women. And for example, if we look at the Apollo era with the lunar missions, all of the Apollo astronauts were men. Subsequently, women have been sent regularly to space, but the numbers are still not close enough to fill the major gaps in understanding of female health and the relationship it has with space. So now if we jump to the early 2000s, major space agencies are starting to really work on understanding the impact sex has on adaptation to space. So in 2002, NASA and the University of Missouri had a workshop to identify research priorities related to sex-based differences in adaptation to space. So they examined available data and they created recommendations to fill existing knowledge gaps on this topic. Then if we jump to 2011, a report published by the National Academy of Sciences in the Life Sciences of Space Exploration voiced the need to thoroughly understand sex disparities. And then as a result, NASA and the National Space Biomedical Research Institute commissioned research in 2013 and put out 6 papers on the effects of sex and gender in adaptation in space. So I gave this bit of historical background just so you get an idea of even when we just started spaceflight and just started the industry in the late 50s and early 60s, considering sex and gender and how that implements spaceflight and how that deals with astronauts' health was considered a bit later in the industry. So next, I'll be going over risks that are observed to be higher in female astronauts in comparison to their male counterparts. I'll be going over a few different body systems, the first being the musculoskeletal system. So women tend to have lower muscle density and more reproductive tissues in comparison to their male counterparts. And this results in them being at a higher risk for radiation damage. So in spaceflight, this has led to fewer missions and shorter duration missions for female astronauts, which does put them at a disadvantage. So also, these differences between male and female astronauts are not only important when considering their health and safety, but also when considering the opportunities they get in the field. Secondly, in the immune system, spaceflight is known to alter immune response. So female astronauts tend to show a stronger immune response compared to their male counterparts. So this ends up manifesting a higher rate of autoimmune diseases in the female astronauts. Next, when we look at the neurosensory system, so female astronauts are much more sensitive to stimuli such as touch, pressure, and temperature. So female astronauts have reported motion sickness more frequently than their male counterparts. And this has been motion sickness both when they initially enter space as well as when they're re-entering Earth after completing spaceflight. And then when looking at the cardiovascular system through prolonged bed rest studies, so these studies simulated microgravity, female astronauts have shown higher risks of post-flight orthostatic intolerance. So Shauna had also touched on this in her lectures, and this is the inability to stand for extended periods of time without fainting. So this is obviously another health concern worth researching and looking more into. And then finally, with the morphology and anthropometry systems, so female astronauts are at a higher risk when spacesuits and life support systems are designed for male models. So since the initial astronauts were all male astronauts, these systems have continuously been designed for their male models, so they aren't specifically customized for these female astronauts. So women on average have shorter stature and airways, smaller lungs, and hence less lung diffusion capacity. So this is not always the case with every female astronaut, but this is just, they tend to have these qualities. And then so NASA, for example, one instance where this issue kind of came to light was that NASA's initial all-female spacewalk was originally scheduled to take place March 2019, but it had to be canceled because they did not have two space suits that would appropriately fit the female astronauts. So the all-female spacewalk was carried out in October of that year, but I think that's an important piece to note, how the lack of proper technology for female astronauts can cause unexpected delays with the research and exploration happening. So this is just another quick image to show you can see the difference in like posture and proportions between males and females and how this can eventually affect how they fit in their spacesuits. So next, I'll be looking at how AI and technology potentially can be used to address these risks. So when looking at the musculoskeletal system, just to recap, the risk we'll be addressing is that lower muscle density and more reproductive tissues put female astronauts at a higher risk of radiation damage. So then wearable radiation shielding is not an entirely new concept. It has been designed for first responders and military members, but then looking at the future, this technology can be adapted to be suited for spaceflight. So a radiation shielding vest would provide mobility. It would provide more mobility than spacesuits would, which are primarily worn during spacewalks, but not during day-to-day life within space architecture, for example, in the International Space Station. So the radiation shielding vest would provide astronauts with this protected mobility when they're traveling between different elements within the architecture. So this design would also protect the most susceptible vital organs, including bone marrow, reproductive organs, and lungs from the effects of radiation. Also, I am noticing we're nearing the end of class. So also if anybody needs to head out, like that's completely okay. If you have somewhere else to run to, that's all good. And then so next, when considering the health of female astronauts who have more reproductive tissues compared to their male astronauts, this would further protect them. Additionally, wearable vests take up minimal space. So this is important since efficient use of mass and space is critical for long duration human flight missions. And then additionally, artificial intelligence can be used to help astronauts detect radiation peaks. If artificial intelligence sensors are put on future space architecture and vehicles, this can allow space organizations, whether public or private, to schedule astronaut activities around these radiation peaks. Therefore, this would protect the astronauts from unnecessary exposure to radiation and then further protect their health. So next one, looking at the immune system, the issue I'll be addressing is that the female astronauts show stronger immune responses compared to their male astronaut counterparts, and therefore manifest a higher rate of autoimmune diseases. So a bed rest study that simulated microgravity conducted by NASA was carried out to investigate the effect exercise and nutrition will have on immunological responses in female astronauts. These findings did show that specialized exercise routines increase immune response considerably. So then when considering how AI and technology can play a factor in this, I think specifically we can draw our attention to immersive technology. So this can directly be implemented to help improve exercise programs for astronauts. For example, virtual reality can be utilized for astronaut workout programs and might incentivize them to want to work out even more. So for example, putting astronauts in settings such as outdoor hikes or yoga studios would make exercise much more appealing, especially if they're slightly isolated from Earth. And this might also help combat feelings of isolation. So I just have a video. I just want to show a few quick seconds of what this VR might look like. So in this video here, you can just see that this VR can look like going through a hike in the woods, which would be more appealing for astronauts who currently aren't home to rather than like walking on a treadmill or lifting weights. So additionally, when looking at the immune system, this can be advanced to be put in like live real time where astronauts could potentially partake in exercise alongside family members or friends who are here on Earth. So to my knowledge, this isn't technology that exists currently, but would be something that might be interested to see develop in the future because this could help them combat feelings of isolation and encourage them to partake in exercise and make the exercise experience more enjoyable for them. So next one, looking at the neurosensory system, the issue that we were looking at is female astronauts reported motion sickness more frequently than their male counterparts. So exercise programs were also suggested as a countermeasure for motion sickness experienced by female astronauts. But since we already touched on how that could be improved with AI and technology, I'm going to be focusing more on medical and pharmaceutical countermeasures. So these have been recommended to combat motion sickness, and artificial intelligence can be implemented as a pharmaceutical tool in spaceflight. So in-person consultations with a pharmacist would not be accessible to astronauts when they are in space unless one of the astronauts is a pharmacist. So an automated pharmaceutical system could improve astronauts' experience in pharmaceutical care. So this could look, for example, like a technology for organizing medicine, counting out medication, and filling prescriptions when necessary. I think this would further allow improve pharmaceutical care for astronauts in space when they just don't have access to the pharmacists we do at home. And then when looking at cardiovascular system, the issue we were looking at was addressing female astronauts showing a higher risk of post-flight orthostatic intolerance. So to combat this higher risk, technology simulated artificial intelligence could be utilized. So this is not exactly a new technology, but the thing that researchers are currently working on is finding the ideal combination of artificial gravity magnitude, frequency, and duration needed to prevent cardiovascular deconditioning. So they're still working on what the right combination of these factors is, but working on this could allow female astronauts to be phased into Earth's gravity when they return to spaceflight. And if this is done gradually over a number of days, this could reduce the effects of orthostatic intolerance. And then lastly, when looking at morphology and anthropometry systems, to counter the risks posed by ill-fitting spacesuits, significant advances in spacesuit design need to be made. So the first thing that came to mind for me was customizable designs. So this would enable any astronaut, regardless of their sex or any other physical characteristics, to wear well-fitted spacesuits to maximize their performance and reduce any related hazards. So this could include, for example, optional padding they could implement into their spacesuits, as well as belts, etc., where it could just be a more customizable design to make sure that it fits all the astronauts properly. And then, so that's my presentation for today. I just looked at how female astronauts are uniquely affected by spaceflight, and then how technology and AI could hypothetically be implemented to address the medical issues they face. I also wanted to quickly mention Dr. Pandya, who served as my mentor for my presentation. And then those are all the works that I cited. And then I'm happy to take any questions if anyone has any. I'll stop sharing here.
So, this presentation was kind of historic. You did something no one has ever done in the 11-year history of the course, which was, the course teaching period specifically ends at 3:20, and at 3:19. You sort of told people if they have to leave in the next minute, that's fine, and so on. And it shows a kind of self-assurance and being on top of things. Very often when students are presenting, they seem completely overwhelmed, like they can't handle anything else. And that was like an extra detail. It was so cool. I also feel that if somebody watches Shauna's lecture and then watches the presentation you've just given, they sort of very well complement each other, and like you were talking about aspects of being female that she didn't actually mention some of them. So it's really cool from that point of view. And it's a little bit like Simon Wu sort of made another kind of history in the course. He gave a presentation when he was taking the course about the quantum aspects of sight and smell that actually went beyond what the lecturer was talking about at that time. And so the lecturer, Jack Tazinski, actually added Simon's topics to his subsequent lectures. So sorry for getting so excited about this, but there's a certain sameness when you've taught a course for 11 years, and even though the teaching sessions are very different every term, and it's really, really exciting to see something brand new happen like this. Yeah, so anyway, yeah, any other questions? I see that Nimna Mendes has joined us. Do you have any questions or comments? Anyway, trying to get more interaction going here, so it's not just me talking. Yeah. Or anyone else? Yeah. So we have 4 more presentations next time on Thursday. I think they'll be of similar quality to today. They include a grade 11 high school student from Calgary. It's kind of stealth, right? I don't think you've ever met him on Zoom. His name is Michael Liu, but he will be presenting on Thursday. And that also breaks new ground. We haven't ever had a presentation from somebody that young in the course. And Kashika S. from India. She's been taking the course, but she didn't feel that she could give a presentation this term, but next term in fall of 2022, we'll have a 15-year-old giving a presentation. How about that, eh? So any other comments? Very interesting topic. Great job, Ryan says. Yeah. Okay, well, thank you, everybody. And we'll see you here on Thursday. I also wanted to mention that you all performed well on the midterm. Some years, the range of grades in the midterm is like amazing, from like 20 to 97. And we're not seeing that this time. So you guys are sort of clustered closer together. So the lowest student is closer to the highest student, which is a very healthy thing. We have coped with those remarkably low scores in the past, but it doesn't look like we have that to cope with this time. So anyway, congratulations to all of you for your good performance on the midterm. Okay, I'll see you on Thursday. Thank you very much.